Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Today, we're addressing a challenging topic that affects many families these days: managing mental health medications in children and teenagers. We need to know these medications are safe, effective, and supportive of a child's overall well-being. Joining us today are Dr. Madeline Camejo, Chief Pharmacy Officer for Baptist Health. Also joining us, Dr. Marie Rossique, Pediatrics Clinical Manager at Baptist Health. They're both going to help us navigate the twists and turns of mental health medication management, as well as answer all your questions on this episode of Ask the Doc. Hi, everyone. I'm Olga Villaverde, and welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. So without further ado, let's go to that first question from Maeve. She writes to us, "Hi, Dr. Camejo. Our son, Declan, was recently diagnosed with ADHD. Is this a condition that can improve over time, or is he going to have to take medication for the rest of his life? And speaking of meds, what are the ones that are commonly prescribed for kids and teens?" So Dr. Camejo, I think this is a question that is on the mind of many, many parents out there.
So yes, Maeve, you and Olga are both asking important questions, and thank you so much for reaching out. But here we're going to list a few signs and symptoms of ADHD, so that we know what we're looking at, and basically having a short attention span, frequently forgets and loses things. And so those are things that you really need to pay attention to. But I just want to let you know that ADHD is really one of the most common mental health disorders in the children. And it affects approximately 10% of US children in schools, and about 70% will continue to have their disorder into their teenage years and adulthood. And hyperactivity usually tends to decrease as they get older, but problems with concentrating, attentiveness can last into adulthood. Therefore, if you're diagnosed with ADHD, it is important to treat the condition. Now, in order to help your child as well to decrease the effects it may have later in their lifetime. So performing poorly in school, difficulties with relationships, and low esteems, it's important to be treated. And the most common and effective medication to prescribe for treatments for these kids usually include stimulants like Ritalin or Concerta, or amphetamines like Adderall and Vyvanse. So if your child does not respond to stimulant medication or has bothersome side effects, there are non-stimulant medication that can be prescribed for ADHD, like Strattera or Clonidine. But your provider will have to perform a general evaluation of your child's mental health, as well as symptoms and your family life and living environment, and that will help provide important information for diagnosing for ADHD. Now, if your child is 6 years of age or older, medications that are most effective treatment for ADHD, approximately 75% will have noticeable improvement in ADHD symptom if you use one or more of these medications. So the other thing I would also say, if your child is less than 6 years of age with ADHD, then you should also think of behavior management training for parents. That can be an effective form of treatment as well. In addition to, some older children would benefit from a combination of behavioral therapies and medications.
Thank you so much, Dr. Camejo. Great information. We got a question here from Phil, and he's reaching through YouTube. So Phil, thank you so much for reaching out to us. Let's see his question. "Hey, Doc, my kid is on Adderall for ADHD, but he's not been sleeping so well since he started taking it. And he's been acting a little more jittery. What does that mean?" Dr. Rossique, let me bring you into the conversation. Isn't Adderall a stimulant, or am I wrong?
You are correct. Adderall is an amphetamine, which is a stimulant medication, and boosts chemicals in the brains like dopamine and norepinephrine, which help with decreasing all the symptoms of ADHD. But however, in addition to helping with these symptoms, it can also stimulate the brain so often, and then he might have problems sleeping at night. So many children diagnosed with ADHD have problems even without medications. Therefore, before looking at whether it's the medication that's having the side effects of not being able to sleep, it's important for also you to look at the sleep habits. So therefore, first start with making sure your child has good sleep habits, like waking up at the same time every day, not taking long naps during the day, which can make him stay up at night. Also making sure that he doesn't take soft drinks that have like a lot of caffeines. And of course, very important, especially close to bedtime, make sure that he's not on the computer or on the cell phone, because all that can also stimulate and interfere with sleep. So if your child is having sleep problems and we think it's due to the medications and you have implemented all those sleep effective methods, then it's important to discuss these concerns with your doctor. Your doctor will assess what is happening and may actually want to change the medication's form. So for example, go from an extended to a short release medication, or even maybe cut down the dose of the medication at night. If you're already on a short acting medication and you're taking it twice a day, you may want to decrease the dose at night, or ask if maybe you can give the medication earlier in the day. So if the current Adderall dose and routine that your child is on is actually helping his ADHD symptoms, then your doctor may want to leave the regimen and the dose as it is, but maybe prescribe some sleep aids like a low dose of melatonin, or even some other medications like clonidine, which will sedate you and will help with sleeping.
Great stuff. Thank you. Dr. Rossique, real quick, I'm so glad you mentioned about the phone before going to bed. What would you think? Like an hour before, just let it go?
I would say probably close to 2 hours, start winding down and not using those electronic devices, or trying to just minimize all these triggers that stimulate the brain.
Fantastic. Thank you so much, Dr. Rossique. Let's turn it over now to a Facebook question. And this one's coming in from Keisha. And this is what she writes. Hi, Dr. Camejo. One of the women in my book club said that her daughter wasn't reacting well to her ADHD medication. My husband and I think our son might have ADHD as well. We'd like to know if there are any natural or alternative treatments that can be used instead of prescription meds. I love this question, Dr. Camejo. A lot of people rather go the alternative route, and I think there is some options out there, right?
Well, Olga, I'll answer that in a minute. And Keisha, thanks for so much for writing in. We really appreciate it. For children, what I would really look at is a well-balanced diet. Avoid sugars, because sugars also create a lot of excessive activity in kids. Avoid also processed carbs. Exercise is really good. Let them, get out all that exercise. Good sleeping habits, again. And at the end of the can, you should try to also maybe help some meditation, even giving omega supplements. Some kids with ADHD have lower amounts of omega fatty acids in their blood. And these fatty acids really do what they do is help neurons in the brain communicate more effectively. And these are all good natural remedies to reduce their ADHD symptoms. However, while these remedies may reduce the severity of it, they do not address the individual's underlying brain deregulation. And so medication today still remains the most effective treatment for roughly 80% of kids with ADHD, and behavior therapy can be very helpful as well.
All right, let's continue now. Instagram making an appearance, and we've got Chad, who has a fabulous question for our dream team. So let's take a look at his question. Hello, doctor. My nephew, Theo, is currently on antidepressants and anti-anxiety medications. I suggested to my sister that Theo should probably be in therapy as well, but she had a bad experience with a therapist and wants to just stick with the meds. Would love to get your thoughts on this. I love this question, Dr. Rossique. I'm going to hand that one to you. What do you think?
I think this is a great question. And Chad, thanks for sharing your story with us. You're a great uncle. So antidepressant medications are the mainstay of treatment for both children and adolescents with depression and anxiety disorders. Treatment of these conditions requires a comprehensive approach. And studies have actually shown that children with anxiety and depression who receive combination of antidepressants and psychological therapy, like how you're suggesting, have a far more effective response and actually do better than those children who were treated with only medication or psychotherapy alone. Non-medication therapies like cognitive behavior therapies are such an integral part of helping children learn skills to deal with depression and anxiety, as well as learn how to prevent situations that may actually trigger these symptoms. Therefore, even if your medications are working fairly well, further improvement with psychotherapy may actually occur, which can allow maybe for the medications that your nephew is on to maybe be titrated to lower doses, or if he's on multiple medications, maybe his doctor would want to maybe discontinue one of the medications that he's on if he's doing so well with the combination. So bottom line, the addition of cognitive behavior therapies may be beneficial and should be discussed with your nephew's doctor.
Thank you so much, Dr. Rossique. All right, let's turn the next question to Suzita, and she comes to us from YouTube. So let's see the question that she has. Dr. Camejo, this is for you. Saludos, Dr. Camejo. My husband and I think our son Julio is not reacting well to his anti-anxiety medication and want to take him off of it. Pero mi hermano said that Julio can get withdrawal symptoms from stopping too quickly. Is that true? And if so, what are the symptoms? This is really important information, Dr. Camejo. You and I have talked about it in the past in other segments about weaning off.
Right. And Olga, you're correct. Susita, thanks for sending in your question. And we really, truly appreciate it. And keep listening to your hermano because he sounds like a real smart cookie. You know, anti-anxiety medication should never be suddenly stopped. It can really cause a variety of symptoms like nausea, vomiting, severe headaches, sweats, fatigue, even kind of like flu-like symptoms and insomnia. So it's really important if you want to take off the meds, talk to your doctor so they can slowly taper you off the drug and so that you don't experience those really bad, awful withdrawal symptoms.
Thank you so much, Dr. Camejo. All right, so another great question coming in for our doctors. And this one's a Facebook question from Jefferson, I believe. There it is. Hey, Dr. Camejo, our daughter Lulu is about to start taking ADHD medication. Can you please tell us what some of the potential side effects are so we can keep an eye out for them? And I really love this because it's really important as a parent, as a caretaker, to be on the lookout for anything that could just, be different. And they're more aware of the situation, doctor.
No, agreed, Olga. And, you really are right about that. But, we have a list here of some of the common side effects of them. When you look at common side effects for ADHD medication, one is decreased appetite. They tend to lose their appetite because the stimulant does that. Number two would be like weight loss. 3, difficulty sleeping. 4 would be rebound effect. 5 could create some tics. 6, minor growth delay. 7 could be an upset stomach, and even changes in blood pressure and heart rate. Those are really the side effects that usually happen in the first days of starting a new medication, or even when you're going to start taking a higher dose if you're being titrated. Now, these side effects are typically mild and they don't last long, but they may be resolved after a few weeks of treatment as your body adjusts to the medications. But if it doesn't, then call your provider so they can either adjust the dose or add another medication to help with the side effects. But, you can look to help mitigate symptoms like decrease in appetite. Plan to eat before the medication kicks in or when it wears off. Take your medications with food or milk. For headaches, give them Tylenol. Don't give them ibuprofen. For insomnia, no electronics. We talked about that. At least 2 hours before bedtime. Use a white noise machine or soft music for relaxation. Put it in their room. That's really always really good. And, sometimes these meds also cause dry mouth. So make sure they have water with them, or give them sugarless candy so they can suck on it, so that'll relieve some of that side effects.
And speaking of questions, we've got one in from Hannah, and she's reaching out through Instagram. And this is what Hannah is writing to our doctors. Hello, Dr. Rossique. How safe and effective are antidepressants and or anti-anxiety for children and teenagers? As a parent, I'm concerned about suicidal risks in children that's mentioned in the black box of antidepressants. What behaviors should we be looking out for? Dr. Rossique, your thoughts on this question?
This is a great question. And Hannah, thank you so much for reaching out. We really appreciate this question. So antidepressants, such as the selective serotonin reuptake inhibitors, are first-line treatments that are effective in relieving depression and anxiety symptoms in children and adolescents. Approximately 60% of these children will respond to the initial treatment. Of those that do not respond to the first treatment, changing to another antidepressant, such as a serotonin norepinephrine reuptake inhibitor, or adding a cognitive behavior therapy, will improve their response. These antidepressants are associated with several side effects. Some of the most common side effects are such side effects that might be mild, that you might be able to adapt to, or that may go away after the initial days of therapy. And these include something like stomach aches, headaches, trouble sleeping, agitation. However, there are some rare and serious side effects, which is important for you to be aware of and your child to be aware of, and as well as for you to discuss with your child's doctor. So, as you stated, antidepressants do have a warning of increased suicidal thoughts and behavior in children. Therefore, all patients who are started on antidepressant therapies should have close monitoring for these symptoms by families and caregivers, especially during the first few weeks of treatment. And if you do see any signs that your child is having some suicidal thoughts or behavior, you need to immediately contact your physician. These are very serious symptoms that need to be addressed immediately. So once again, determining whether the antidepressant increases the risk of suicide is difficult, because we know that children that are depressed or have anxiety are more likely to think about suicide and even attempt it. It is therefore important to treat the underlying depression with these antidepressants in adolescents and teenagers, since it may actually be the best way to prevent thoughts and behaviors about suicide. So parents should play an important role in talking to their children and asking them if they have any thoughts about hurting themselves, and make sure that the environment at home and the environment in school is actually a safe environment. So very important, talking to your child about suicide does not cause suicide thoughts. Okay, but it will let them know that you are concerned and you're willing to help. So once again, anyone who is thinking about suicide needs immediate attention by a doctor.
Thank you so much, Dr. Rossique. Great questions coming in, and we really appreciate it from our viewers. We got one from Suki, and this one is via YouTube. And Dr. Rossique, we're going to turn it back to you, so stay right there. What are the most commonly prescribed medications for children and teens with anxiety disorders, and how do they work? Doctor?
Okay, great question. So the most commonly prescribed anti-anxiety medications for teens and kids are the antidepressants known as the SSRIs or the SNRIs. Those are the mainstay of treatment, and I'll go over a little bit more in detail about them. There's other medications that can be prescribed also for anxiety, and these fall into different classes and have different mechanisms of action or the way that they work. Some of these are like benzodiazepines, like Ativan or Klonopin. Some of them can actually be like atypical anxiolytics or even antihistamines can be used, or another class of drugs, which are the alpha agonists. So antidepressants are, as I stated, the most commonly prescribed medications for anxiety in children and teens. These medications were initially used for depression, hence the name antidepressants, but they are also effective for anxiety. The most effective antidepressants are the selective serotonin reuptake inhibitors. Those are the ones that we call SSRIs. And the selective norepinephrine reuptake inhibitors, those are the ones we call SNRIs. And they work basically by increasing the levels of certain chemical neurotransmitters, such as serotonin and norepinephrine in the brain. And these neurotransmitters regulate or control anxiety, mood, and social behaviors. They block the reabsorption of serotonin and norepinephrine back into the nerve cells that release them. Thereby, they raise the levels of these neurotransmitters in the brain, which can help with all these symptoms. So it's important to realize that both serotonin and norepinephrine play a role in attention, memory, as well as learning. That's why they're used in so many mental health disorders. Serotonin is also important in regulating sleep, mood, and appetite. So as I said earlier, less commonly prescribed medications for anxiety can also be the atypical antipsychotics, which are sometimes called the second generation antipsychotics. And they're used in children with anxiety disorders associated with emotional bursts of emotions by blocking serotonin and dopamine neurotransmitter. Once again, these neurotransmitters that are in the body and are causing all these symptoms. In addition to these medications, there's also certain medications like clonidine, which reduce the release of these stimulants in the brain and can actually calm your child. So doctors, once again, may prescribe other medications as well. There's so many medications that we can prescribe depending on the symptoms of the child and other concomitant mental health issues that they might have. And one of the ones that are used is for a short period of times are the benzodiazepines. So the benzodiazepines are medications like Ativan and Klonopin, which can be used in children or teens that have these anxieties that are associated with certain times. Like, for example, if they're going to be in a class and they have to do public speaking, so they might get very anxious about it. So you can give these medication for a short period of time to help with that. But benzodiazepines also can cause or habit forming. So we don't want to use them long term because then they can actually withdraw from them. And then other medications that we use all the time that can also be used, may not be as effective, but some teens actually do good with them, is actually using like Benadryl or Atarax, which can actually reduce anxiety also for short periods of time.
Fantastic. Thank you so much, Dr. Dr. Camejo. We only have about a minute left in the show, so I was just wondering if you could just wrap it all up and give us some final thoughts, if you don't mind. We got about maybe less than a minute.
So just remember one thing also is that, anti-anxiety and antidepressive medications can be unpredictable, especially make sure people sometimes want to give over-the-counter medications. It's a no-no. Always talk to your prescriber about that. Flu, and especially if you're going to give cold and flu medications, these medications really have a lot of interactions with them. So please talk to your doctor or your pharmacist before you give any over-the-counter medications. I think that's That's an important message that people need to know. It's extremely important because they can have severe side effects with your child when you're on an antidepressant or an anti-anxiety medication.
And Dr. Camejo, of course, and knowing that you're not alone, because a lot of parents feel like they're just maybe alone in the situation. There's so much of this that we're creating awareness, which I think is so important, right?
Absolutely. It really is important for kids to reach out to their parents, as well as your parents to really be get in there. If you see your child is very withdrawn, pay attention, talk to them, make sure that they're always there to help.
Thank you so much to both of you. And that's all the time we have today for this segment of Ask the Doc. Have a great day.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.